Bone scan. So bone scan is imaging that detect distribution of injected radioisotope on a camera sensitive to emitted gamma X-rays and assess the bone turnover. In orthopedic, normally we use technetium-99. MDP or MDP has the affinity to osteoblast and bone turnover. It has a half-life of 6 hours. Gallium. This has affinity to inflammatory cell, leukocytes, and bacteria. Gallium uses indium. Indium has affinity to leukocytes, and leukocyte scan can be done. Some of the radioisotopes used. Gallium is 157. Gallium is 67. Gadolinium is 157. Iodine is 131. Indium is 111. Technetium is 99. 3 phases. Blood flow phase, which is 1 to 2 minutes, it's called angiogram. Blood pool phase, which increase vascularity due to inflammation, it's in 30 minutes and can detect infection. And then the bone phase, which is 4 hours. It can trace in the bone infection, tumor, Paget disease, fracture, non-union, aseptic loosening. Cold scan. Multiple myeloma and 50% are cold, and mets from renal and thyroid are also cold. Flare phenomena. Paradoxical increase in uptake following chemotherapy as a result of bone repair. Superscan. Superscan is when intense symmetrical activity is seen in bone with diminished renal and soft tissue activity. This occurs because of diffuse metastatic spread, renal osteodystrophy, metabolic bone disease, Paget's, and osteomalacia. Disadvantages. Radiation dose is equivalent to 63 chest X-rays. Non-specific. WBC leukosan. WBC is removed from the patient, tagged with indium, and then re-injected. Takes 2 to 3 hours later. Patient scan is done in 6 to 24 hours later. Instructions to the patient after the scan: drink a lot of water, use different loo, flush toilet twice, avoid pregnant women, and will be detected for airport for 1 week. SPECT scan, single photon emission computerized tomography, is a 3D bone scan. Images are reconstructed in axial, coronal, and sagittal planes. PET scan, positron emission tomography. This is for tumor diagnosis. A fluorodeoxyglucose, FDG, is injected, transported, and accumulates in the area of high metabolic activity, emits positrons, positive charge, that react with nearby electron to result in photons. Successive chemotherapy causes decreased uptake. Specific isotopes: C11, O15, F18.